Greetings to the DCHI world. We are here in Houghton Power FM. I'm with my director, my senior, Saneli Sonkonyeni, and I am Kosnathi Nkosi, aka Smeganati. Yay! We're about to make history. DCHI, follow me. Spagat. Welcome back. Stay with us. We are on Power Perspective. I'm your host, Colleen. And this brings us to our next topic. I'm very excited, very excited that these two gentlemen decided to join me in studio. You know how nice it is here at Power Perspective. We have fun until midnight, and I'm joined this evening by Nkosinathi Nkosi, who's the Creative Director of Deaf Care Healthcare Initiative. And I'm also joined by Sanelisa Nkonyeni of the Senior Director Deaf Care Health Initiative. But let me tell you a little bit about this initiative that they're going to be talking to us about, the Deaf Care Health Care Initiative, DCHI. That's the short for Deaf Care Healthcare Initiative. They use AI, artificial intelligence, very innovative. I mean, if you're not on AI now, you are going to be left behind, because AI is here to stay, and our world is fast changing to technology. AI, it runs military, it runs healthcare, it runs our wealth, it runs money flow. Now it's running how the deaf community interacts and integrates and advancing themselves in an inclusive manner in the normal community that we live in as people that hear, etc., so they're able to get equitable access and care. But what is shocking is that in a country where over 4 million deaf and hard of hearing individuals, they face daily challenges in medical settings. Over 4 million. I didn't know this. Over 4 million. And we're going to get some of the facts now. So DCHI is building an inclusive healthcare ecosystem, prioritizing accessibility, dignity, and equity. So the initiative integrates innovative solutions such as AI, as I said, part mobile technology on demand, sign language interpretation, training for health professionals, and deaf awareness. And but beyond this delivery, DCHI represents a broader social movement, one that empowers deaf communities, creates employment opportunities, and ensures that no patient is left unheard. I loved this. When I read it, I was like, wow, what a slogan. Nkosinathi, good evening.
Good evening, Gunjani. I am awesome.
You're looking good, you're feeling good. I love the energy. Sanelisa, good evening.
Good evening, Colleen, how are you?
I'm good, thank you. I'm good.
Well.
Look, this no patient is left unheard. No patient is left unheard. I think it's a powerful statement. What brought that about, Sanelisa?
Definitely, Sis Makubele, we at DCHI, we found that many of the deaf and hard of hearing people or community in South Africa are facing a lot of miscommunication when it comes to the healthcare center or services. So DCHI comes about in that manner to say access to healthcare should not depend or be in a space where you've got to be of hearing so that you get access. There's a lot of misdiagnosis in the healthcare services. There is a lot of gaps when it comes to communication, where a patient and a doctor or a nurse.
And I can imagine, because there's no special, excuse me, unless I may not know, excuse me. I haven't seen a special healthcare facility that just caters for the deaf. So they would need to use the same healthcare that you and I, who can, hear much better than them, go and use and see the same doctors. And they must now be able to understand what they are saying and their symptoms. That must be difficult. I never thought about it.
Definitely. So DCHI has come with a different or multi-layered solution to that space, so that we are able to have an inclusive healthcare system that works for the deaf and the hard of hearing. So deaf care, healthcare exists to change the reality of the deaf and the hard of hearing. So we are building this organization to make sure that they are part of us. We know the constitution comes into play where it talks about the 12th language, of which is the sign language. So we need to integrate all of that and make sure that the deaf and the hard of hearing, they live like me and you, Sis Makubele.
Wow.
Yes.
And Nkosinathi, what inspired you guys to get into this? How? I'm asking myself. These are two, youngest relative, but they're not elderly. They are men. I'm saying young, not because you're youth, but these are young men that, could be doing anything in life. And I saw your qualifications as well, which we'll talk about now. But here you are, taking upon your shoulders such a huge responsibility that for many years has been neglected. I mean, I'm shocked at the numbers that I've seen. 4 million deaf and hard of hearing, and they have to use the same healthcare facilities that me and you go to, and we can talk and hear and be able to communicate what we want. What led you to this?
Well, it's a powerful question. Basically, I would say it's divine plan. Because also I hail from a media background, music background. I never thought that I would see myself putting a hand out there to the deaf and the hard of hearing people. And then, to be honest with you, I grew up wanting to be a doctor when I was in primary.
Yes.
And then now, after 15 years down the line,
you ended up in music.
I get myself in music, and from music, I was actually doing a tour shooting diasporas exploring South Africa. And then I met this gentleman, Herbert Prinsloo, who said, "Yeah, man, I see you with your cameras, but perhaps do you do app developing?" Because of, I integrated myself with the technology and AI, because if you are not adapting, you'll perish, you'll be replaced. So I found myself being enticed by this idea, because I've done app developing, but not of this caliber, not whereby I have to translate sign language into words and text. Yeah, so
you studied technology.
I had to, because it will replace me if I don't.
So it was a fear of losing your bread.
Yes.
Yeah.
And again, when you read the Bible, it says, if
yes,
you don't, knowledge
yes,
is power. If you don't seek knowledge, you'll perish.
Yes, true.
So
true.
Yes, so for me, utilizing AI to this deaf community, it was a powerful element that we brought.
So you were using AI prior to taking it beyond your music?
See, to be honest with you, the app is fully AI integrated, because when you sign, it gives text and voice.
Okay, so you
when you do the "I love you" sign on the app, it says "I love you."
Wow.
So the technology is still high. However, we haven't yet fully integrated it because
and this is "I love you" sign.
Yes.
For those that will watch the video later, this is "I love you" sign.
So the challenge was the building database is a problem. So that's where we come to stations like Power FM. Maybe someone out there will be listening to us who can assist us to carry on capturing the South African Sign Language database. Because out there, the deaf and the hard of hearing database is done, but in an American way, in the UK version. We don't have South African Sign Language database that, we can utilize like 100%. We are still feeding in this AI a South African Sign Language. We are still teaching the AI how to...
Does sign language differ?
It does a lot. Basically, just to give you a hint of how does it differ. When you sign something and then you don't move your neck, in America it means another narration. In South Africa, when you sign and move your neck or tilt it, it means another. Meaning.
Okay.
So it differs. So in South Africa, the sign language people, they've developed their own slang, their own language.
Okay.
And then when you go to America, they also do their own sign language, their own, it's vice versa. What you do in South Africa, you might find that it means something in America,
Yes,
but
yes.
it's all sign language.
Yes, it's
So-
like us when we talk, we've got our own lingos that
Yes,
we kind
and to be honest with you, and this is what we are bragging about, we are the first in Africa to be doing this.
Wow,
And
wow.
yes.
I think that deserves a clap.
Indeed.
Excellent.
Yes.
Well done.
Thank you
well
so
done.
much.
But how are you finding the reception of this kind of an app in the medical fraternity and beyond with investors?
No, that's a powerful question again. To be honest with you, we are still new.
Mm-hmm.
We are infants, but with big steps.
Yeah.
We are still integrating the healthcare system,
Okay.
meaning that what we want to perfect our application first, but the application is presentable. There's a demo version ready to showcase the sponsorship, the investors, to say this is what we want to achieve,
Yeah.
this is what the app does, but this is what the app lacks. And for us to meet the app's requirement, we need this type of assistance. But nonetheless, we are on the right path. Our developers, because I'm a senior developer that works with other developers,
Yes.
so we are putting more extra hours on it,
Yeah.
perfecting it. So already the app has all these tools the deaf and the hard of hearing have. The emergency button is there,
Yes.
so
yes.
meaning that there is no more delay. We have our interpreters 24 hours that will be ready to assist the medical healthcare settings to translate the message of a deaf patient.
And I mean, when we talk about sanitary emergency, it's so important because we know the statistics of those vulnerable communities in terms of crime as well are quite high, and they are not able to even report crime.
Right.
And they get raped, they get mugged, they are even taken advantage of by community members who know that they will not be able to communicate what has happened to them. Is the aim of the app to also capture that and assist them in not just hospital, but also if they need to go and report crime in the police station, etc.?
Yes, definitely. So what we want to make sure is that the app is user friendly to cover every aspect, especially for emergency settings, especially in the healthcare center.
Yeah.
But for now, this HI is mostly focused on the healthcare
Yes.
system
Yes.
in South Africa. That's why we're building this app, because we want to make sure that whenever they reach to an emergency care setting,
Yeah.
they are able to find assistance. In the labor wards, doctors are unable to communicate with a deaf person or hard
Yeah.
of hearing. Sometimes they get misunderstood,
Yes.
and sometimes they get a misdiagnosed,
Yes.
and all these things they linger to them and have a bearing to their health.
I mean, I can just imagine how frustrating it is. You're trying to tell somebody, you know what, I have a toothache.
That's right.
It's not here, it's here. And
Yes.
they just can't understand you.
Yes. So that's why then DCHI, in this app that we have, we have integrated the interpreters, sign language interpreters, to be able to, if a deaf person comes into a hospital, the app is able to signal if the doctor needs an interpreter for the patient. And we want to make sure that they are 24 hours available.
And how did you two meet? When did you start to collaborate?
No, it's a powerful question because many people have been asking how
Yeah.
did we meet. I will say it again. It's divine connection.
Divine connection.
Number one. Number
Yes.
two, we met in a boardroom.
Right.
When I was introduced to the team,
Yes.
I was told today, and then the meeting was happening tomorrow. I didn't sleep that night. I developed the app so that I just showed them on the meeting.
Yes.
That, are you looking for this?
Oh,
So
wow.
that's how we met online.
Did you know a bit of sign language?
Nothing.
So-
I don't know anything about sign language, but I am too technically inclined.
Yeah.
I know what I can do, But this app cannot be done without the deaf people. Actually, this whole mission of DCHI, we will integrate a lot of deaf patients, because with them we get those solutions. They allow you sign to learn it through the journey.
Yes.
You know, I'm still busy learning sign language myself, so that as a developer I know how to, you know, tweak
Yes.
certain things.
But I'm surprised you started with "I love you." Why?
Yeah, you know, it's one love.
One love,
One
one
love.
love, one love. Listen, we're on Power FM, we're on Power Perspective. It's indeed one love on Power Perspective tonight. I'm your host, Colleen. I'm talking to Deaf Care Healthcare Initiative, the founders of this beautiful initiative, which uses AI, artificial intelligence, to bridge communication gaps in healthcare for the deaf community, improving access, reducing the risk of misdiagnosis and risk of miscommunication, and advancing inclusive, equitable care. I'm with Nkosinathi Nkosi and Sanaliso Nkonyeni. It's one love. We'll be back.